Harihi Gurur Brahma, Gurur Vishnu, Gurur Devo Maheswara, Guru Sakshat Parabrahma Tasmai Sri Gurave Namaha. Namaskaram, Master. Gnananandamayam Devam Nirmala Spatikakrutim Adharam Sarvavidyanam Hayagrivam Upasmahe Hayagriva Iti Yovadet Tasya Nissaradevani Jannukanya Prabhavatu Om Shanti Shanti Shanti. My pranams to all the homeo legendaries, masters, Dr. Hanneman, Dr. Kent, Master E.K. Garu, and Dr. Chalapati Garu, and my special pranams to Dr. P.V. Satyanarayana Garu. So I've been discussing about the biochemic salts in the last two episodes. Third part, this is part 3. We have discussed what is biochemic salt, what are the biochemic salts, how they are invented, and Dr. Hanamaya Garu has given a very elaborate idea about the preparation and other things. I am only giving a brief, refreshing type information, and also I want to encourage the students of HSRF and other persons who are listening to this video to use the biochemic salts as a first aid. Use it. You will know the efficacy of it. And it is a wonderful system where absolutely there are no side effects and easily we can administer them, and many cases there will be relief, or sometimes there is cure also in homeopathy. It is a part of homeopathy, and they are giving us an idea about how the medicines work and how we can give medicines to the particularly the acute complaints where they require a little support or whatever is there, that is enough for us. So let us now start the next part of this biochemic salts, that is part 3. In this we are going to discuss 3 major salts. Biochemic salts, I told you, can only replenish whatever is their deficiency of the particular salt in the bloodstream. It will replenish and the cure is faster than normal cure. Given one homeopathic medicine along with the biochemic salts, the cure will be much faster and very easy to find the drug also, because medicine, there are only 12 biochemic salts we are using, out of which 2 we discussed already, calcarea fus and calcarea fluor. Even a layman can use them as a first aid. If with the administration of these biochemic salts, if there is no relief, you are expected to immediately contact the nearest qualified doctor, either homeopathy or allopathy or any other system. Now, what I would like to now tell you is the system that we have adopted is homeopathy, and biochemic salt is a part or a supplement to homeopathy. Now, today we will discuss 3 important salts of the family Kali or potash. So we have discussed already calcium. We have discussed 2. We have discussed, one is left there, calcarea sulfuricum. I have to tell that, and I will tell that, and also we'll discuss Kali, that is Kali family, potassium family. So now we'll finish the calcium family, that is calcarea sulfurica. Please note down if you have pen and paper. Calcarea sulfurica, we call it as CS. This is also one of the very important remedy in biochemic salts, and this generally we use for the purification of the blood. When there are impurities in blood, calcarea sulf is the medicine which will improve the quality of the blood. The impurities will join the bloodstream because of the medicines what we take, because of the pollution, because of the chemicals what are being used on the pest control for the fields, that is vegetables, fruits, etc. So because of that, some toxic material or some poison will be entering the body, and blood also has some toxic materials. The calcarea self, we call it as CS. It will cleanse the blood. And regarding mind symptoms, sometimes there is a sudden loss of memory, or even patient may become fainted also, and he's irritable and absent-minded and very anxious. But the patient is better when we take him out or when there is a open air. The patient feels better. The patient is not contented with anything, and of course, he has also a few unknown fears. These are the simple mind symptoms we can tell. And here, very important point what we have to know is there are two medicines. One is Silesia and the Calcarea salve. The both are the one after the other. That is, when there is a suppuration, there is a wound, when there is some pus coming out. What we use? We use first Silesia. I will tell you that is the 12th salt. We'll discuss at the end of the course. Silesia, what it will do is it will expel the pus out. It will just collect the pus from all the places in the body and it will simply expel it. But after that, the wound should be healed up. Unless the wound is healed, the patient will be having the discomfort, open wound, something. So we need one agency which will clean. That is like patching the road work and other things. We have separate maintenance staff. Similarly, calcare yourself, it will hasten the process of the healing of the wound. So when the wound is open, having much pus or something to come out, do not use calcare yourself. First use Silesia, let it come out. And when there is nothing, only a red wound is there, which is to be healed completely, give calcarea self, it will simply lay the road and the skin will be normal. So, any suppuration, any pus formation, any wound is there, for the healing up of the wound, after the expulsion of the pus, you should think of calcarea self. That you remember very well. And of course, like homeopathy, biochemical salts also have the symptoms of all the organs. This is also holistic. How it differs from homeopathy, I told you, I repeat again, it is the potentization process where in homeopathy we do it 1 is to 99, we call it as centesimal system, and in biochemic 1 is to 9, we call it as a decimal system. That is why we denote it by X. X is actually 10 in Roman. That means when you say that calcarea self 3x or 6x or 12x, X means the preparation of the medicine is done in a decimal system. That is in biochemical salts, we go for decimal system process of potentization. So generally calcarea self, there may be some wounds and there will be inflammation is there, some yellow matter is there, then there will be thick pus formed, then ice, agglutination, we call it as, and then ears also there is discharge of some discharge from the ears, some sometimes with mixed with blood. After silesia, give calcarea sulf. There will be pimples and there will be swelling of the face and cheek, and if there is separation, if there is a tendency to form pus, so let it come out. After that you give calcarea sulf. Then the pimples of the younger generation, calcarea sulf is one of the best medicine, and patient will be having gum boils also. So the tongue is that is mouth is dry. There will be yellow coating. So you will find yellow in two things. One is calcareous sulf and another is kali sulf, which we will discuss while discussing kali salts. So there will be some separating sore throat and ulceration may be there. There will be discharge of matter, and also calcareous sulf works for some desire for the fruits, tea, and then green sour vegetables. There will be thirst and also appetite is more. Sometimes reeling sensation or vertigo. Sometimes vomiting sensation. We call it as nausea. Then calcareous sulfate is the medicine, very good medicine for any abscesses about the anus, that is fistula type, any this one is there, and to expel that silicea, to patch it up, normal skin will come with the calcarea sulf. So this you know, now you understand. This is how we have to treat the patient, and there will be sometimes urine will be red. It may be with the fever sometimes because of the overheat. Some blood may be going out. Need not worry. Homeopathy has wonderful medicines. Even nephritis, where kidney there is some problem, and this will work very well. And sometimes cough with yellow flu, that is yellow sputum, will be there, expectoration. This will work very well. And white, yellow, or pus like secretions, just like Cali Moore, that is after Cali Moore also you can use this. So remember one thing, calcareous sulf is the cleaning of the blood and healing of the wounds. These two, if you remember and you use them well, 100% you will have very good treatment or recovery. And another important point is this person, the calcareous sulf person, will have sometimes fever and skin eruptions will be there, cuts, wounds where it is to be healed up. So this is the medicine. And this, of course, is used very frequently because after silicea, we will go for this medicine. This is calcareous salt. I will just briefly, I will tell about all the salts so that you can easily use them in your regular practice. I told you last time, one of my friends will give you even the kits also, 12 biochemic salts. If you want, you can contact me. My number you know. So if you contact me, I will give his number. You can order. You will get the medicine to your house by courier. Need not go. He is from Hyderabad. He is a manufacturer, of course. He will give you all the 12 biochemical salts at a very reasonable rate. Okay. This is calcarea salt. So we have three calcium, calcarea phos, calcarea fluor, and calcarea sulf. Now we'll discuss. There are three kali or potassium salts. Three are there. First is kali mur. This is kali muriaticum. This in chemical we call it as potassium chloride or kali chloratum. This is the medicine prepared from this kali mur, that is potassium chloride. And this medicine is the first one, please note down, kali mur. The first symptom is cough. You should note down that cough is the first one to remember when you use kali mur. And also no appetite. In Calimore, Kent Materia Medica, if you read in homeopathically prepared medicine, Calimore, there is one important symptom. The Calimore patient wants to die of starvation death. He doesn't want to live. He will not commit any suicide, but he will stop eating food, no appetite. Our Guruji Master EK has given in one case where the person has stopped eating food because of some problem. So master gave him Calimore in potency, that is 200 potency, one dose, he started eating. Recently in Bangalore, one of my patients, a lady aged about 65 years, something 60 years, she also has stopped eating, no appetite, I don't want to eat like that, some symptom has come out. So with Calimore 30, when we gave one dose, within half an hour, that old lady asked for food. She wanted to eat food. That is how homeopathy miracles her. So Calimore, remember two symptoms. The main symptom, mind symptom, is the patient wants to starve, no food. So this is the main mind symptom. And Calimore patient is very, another important point is corresponds to the second stage of inflammations. First stage of inflammation, ferrum phos is the medicine which we are yet to discuss. And second stage of medicines, this is one of the best medicine. And there will be white or gray coating at the base of the tongue, and there will be some swelling may be there, tongue swelling may be there. The discharges are thick, white, uh, from the any part of the body, and Another important Calimore, what we wanted to give the medicine is this is a very important medicine for sick headaches. That is headache with white coated tongue or vomiting of white phlegm. This is one of the important symptom. And want of appetite, no appetite, I told you. So this is one of the best medicine even for dandruff. You can use if other symptoms tally. The totality of the symptoms is a keynote even in biochemic salts. If we are told, might have told only four symptoms, out of four, at least three should be present. Thus, you must remember that. And feeling of sand in eyes, sometimes cataract, you can give calcareflor and also calimore if the symptoms tally. And very importantly for earache sounds, humming sound, some disturbance in the ear, calimore is the best medicine. Particularly the children, they cry holding a ear like this. Calimore will work. Magnesia phos, of course, is one of the pain drugs. So this is one of the important symptom for all kinds of discharges from ears. There will be sometimes yellow discharge. There will be even the tubes are closed here. Hearing also is affected, and there will be noises in the ear. This is one of the important symptom. And dry cough is one of the major symptom of Calimur. Calimur means when there is a cough, Calimur will be there. In the preparation by Dr. Satyanarayana Garu, the CCF, cold, cough and fever, Calimur is present in 6x potency. So the Calimur is for, in Kannada we call it as Calimur Kemminamur. That means it is a cough remedy, particularly dry cough. During dry seasons, this is the one of the best medicines. And also it is the medicine for sore throat and pain in swallowing. They cannot swallow easily. And tonsils. Remember, tonsils along with the Beretta carb in homeopathy. Put the patient on Calimore. Wonders. I might have treated thousands of cases with Calimur 6x. Children, don't get them operated for tonsillitis. Tonsils should never be removed. You give Calimur 6x daily, morning, evening, one or two tablets for children. No necessity of surgery. I have treated thousands of cases, particularly the children up to the age of 10 or 12 years. Calimur is one of the best medicine for inflammation of tonsils, and there will be white deposits in the throat, tonsils, and also adenoids. Very, very important. And Calimore is the medicine for all types of tonsils, all types of tonsils. Then it is also very important medicine for what do you call as appetite. I told you no appetite. This is one of the best medicines. And also this is the medicine for jaundice. Jaundice, there are three important drugs. One is natron sulf, another is calimore, and the ferrum phos if there is slight fever or something like that. So there will be jaundice sometimes, and constipation is one of the important remedies, and also diarrhea. Here you will be surprised. How is it that in the same patient constipation and diarrhea exist? Yes, it is possible. Diarrhea may be alternating with constipation. Constipation may be alternating with diarrhea, or for some cases only constipation, some cases diarrhea. This is the medicine for both the stages. And also piles, Calimore is one of the medicines for bleeding piles. And regarding urinary bladder, then there is an acute inflammation of bladder is there, Calimore will work. It is the chief remedy for chronic cystitis also, and kidney problem, Calimore will work very well. And nowadays we are getting more uric acid problem. Uric acid levels are going up. So Calimore is one of the best medicines to balance the uric acid levels in the patient. And for white discharge, we are told calcarea fast for ladies. Calimore also will work. See the symptoms and you can give. And during pregnancy, early stages of early months of pregnancy, the woman will be having vomitings. We call it as morning sickness, Calimur is one of the best medicines when there is no appetite. You have to again see the symptoms and then medicine will be selected like that. And this is one of the best medicines for all kinds of respiratory problems, even loss of voice, hoarseness, and also asthma is there, and gastric derangements are there. Bronchial asthma, it will work. Second stage of inflammation of bronchioles, and then there will be thick white phlegm will be coming out, and there will be noise in the stomach. Good, good, good. That noise also it will work very well. A loud cough, sharp cough, acute and spasmodic. Continuously, you will be coughing. Calimur you give. It's a wonderful remedy, I'm telling you. Okay, next. There will be rattling sounds. We call it in Telugu, pilikutalu. Some gur while inhalation and exhaling. The gur sound will come. So that is one of the best medicines. And glands, neck glands swollen, adenoids swollen, tonsils swollen. This is one of the best medicines. And there will be pains, rheumatic pains are there. Even chronic rheumatism and swelling of the joints also can be reduced with Calimur. And this is one of the specific chief remedy for even epilepsy. We give Califas, even Calimur also works very well. And the patient, particularly the children, they get up startled. We call it in Telugu as ulikipattam or bechibuludu. So that is they will stimulate startle, a sudden jerk they will wake up. So Kali Moore will work very well. And sleep is not that refreshing. A restless sleep of the patient, they will report that sleep is not good. So Calimore is the medicine, and this is also the medicine for the person having boils, abscesses, carbuncles, etc. This is one of the best medicine. Even for skin complaints like herpes zoster, then ulcers will be with whitish and floor-like coating will be there. It will work very well. And also this is a medicine for anemia, where it will improve the blood count in the patient. And in any glandular swelling, this is the medicine you should think immediately. Now, all the stomach and abdominal symptoms of this drug are worse after taking fatty food or any rich food like pulsatilla in homeopathy, calimore in biochemic system. So, this is the medicine to be used. I told you, potency is always 6x. For all the biochemic salts, Master EK has prescribed 6x, and you can repeat the medicine every day, twice or thrice or once. That depends on the intensity of the case. And because you will ask me again, how many tablets? It differs from 1 tablet to 4 tablets. Maximum 4 tablets, maximum number of times 4 times. In a day, a patient can consume 16 tablets, and potency is standard. Master EK has suggested 6x. So this you remember, and if you order for the kit 12, you will get to the house that you can get them, because all the 12 will come in a packed form. So this can be given. And Cali Moor is also a medicine for all kinds of dry cough. When there is a cough with phlegm also it will work, but more with yellow expectoration. We have got another medicine, Cali self, that we will discuss. So that's all about Cali Moor. You understand this much. That is enough. Now we'll discuss about Cali Fas. Cali phosphoricum. This is potassium phosphate. We call it as in short name KP. Cali Fas. Calimur short name KM. Calcarea Fas short name CP. Calcarea floor CF. Calcarea sulf CS. Because many people are asking me over online treatment because of the COVID we are giving. When I say KP, they don't know what is KP. KP is Cali phosphoricum. And these 12 salts, if you listen and then if you can understand well, you can easily give to anybody in the house. Of course, the rule always stays unless asked, do not prescribe. They should ask for the medicine and without any side effects. Absolutely. Only 12 remedies. You can use them very easily. So, Kali phosphoricum, KP, short name, it is potassium phosphate or phosphate of potassium. You can call it anyway. This is the medicine for the main symptom, guiding symptom of the Kali phosphoricum is nervous disorders. any kind of nervous problems. This is the medicine. And also it is called the sleeping pill of biochemic system. For all those people who are not getting good sleep, for all those people who have the problem of insomnia, Caliphosphoricum is the medicine. Just before going to the bed, let the patient take 2 or 3 tablets and then have half cup of warm milk after 10 or 15 minutes after taking the medicine. And you will ask me gap for biochemic and food and other things. 15 to half an hour, 15 minutes to half an hour is the ideal gap. For water, it can be 15 minutes. For food, a minimum of half an hour, you can keep the gap. And there are people who are taking allopathy also because of diabetes or blood pressure or some other problem where every day they take the medicine. For such people, this medicine can be taken with half an hour gap. This can be given either before food or after food. There are no problem with the food, and because there are no strong antibiotics or steroids, such medicines are not there in homeopathy or biochemistry very easily. And the cost of tablet is so cheap that 200 tablets, the MRP is 100 rupees. That means 50 paisa. And we are supplying the medicine at a very with discount directly by the supplier to the person who is asking for the medicine. Now, when you go to mind symptoms of Caliphosphoricum, I told you it is the medicine for nervous system. It is the medicine to soothe the person. So there will be anxiety, important symptom. Anxiety is one of the very important symptom. Patient is very moody, and there will be some fancies. He will take this, he like that. Something, nothing is liked by him, and he is a pessimist. Always looks at the dark side of everything, and there is a negative opinion or a dullness. He does not know whether he will win the business or not, whatever is their job. He has always depressed spirits, so he's in a depression. And this is one of the best memory tonic also. This can be given to children who are going for examination along with the Brahmi. Brahmi is the medicine we use in Ayurveda. In homeopathy also we have Brahmi in 1x or 3x potency. And Caliphas is one of the best memory. So this, if you can give to the student or children who are going for who are going to the college or school, Scally fast 6x and daily night 2 tablets for about 2 or 3 months. Memory power will increase, grasping power will increase, and it will help even the old people where they lose the memory, loss of memory. This is the one of the best medicines. Patient is dull. He says no energy. I want energy, and he cannot take any work, hard work he cannot do, and decision taking is very poor. Moods are changeable, and there will be effects of fright. Somewhere he has seen some scene, and then he got frightened. After effects of either fright or even grief, lost something, and then because of that he become very poor or very dull. Even such things, it will work very nicely. This is one of the best medicines. And even the insane patients, demands, hysteria, where there is a schizophrenia, all these mental disorders, Caliphas is one of the best medicines. Remember, this is one of the best medicines even for hysteria, even mental derangements, profound weakness, and loss of spirits. He can't do anything. Mania, historic, that is hysterical yanning. He will be simply yanning. Hysterical. Mental aberrations. This is one of the best medicine. And brain is softened. Suppose softened brain is there. Early stages, you can give Caliphosphoricum. All types of nervous problems, this will work. And the child always wants to be carried from room to room. He wakes up very easily, and if he is irritable, nervous, and drowsiness is there. So inability to remember, restlessness, and these are the main mental symptoms. And there will be vertigo, that is head reeling will be there. From lying and standing up, from sitting and looking upward, this is the medicine Caliphas. All types of nervous disorders, you can go for califas. And there is concussion of brain is there in some cases where califas can relieve that. And a patient will be having headache, pains in the weight back of the head across the eyes, and headache is better while eating something. Feeling of exhaustion, inability, he cannot think anymore, neuralgic headache will be there, and back of the head is sore as if head was pulled. The patient complains like that. And weakness of the sight, I told you, there are some cases where the sight is becoming weak because of the nervous disorders. So califas can restore the problem. And of course, ear also connected with the ears, nervous ears are there. Definite deafness cannot hear because of the nervous disorders. There will be some problem in hearing. Sometimes there will be pus coming out of the ears, and that may be giving bad smell. And this is the medicine califas can be given. Now, coming to the tongue excessively dry in the morning, and of course, toothache will be there, tooth feels there. So, even the tonsillitis, I told you, calimur is the medicine. Even califas also will work for other other symptoms if they tally. This is one of the problem. And gastric problems also califas will take care. But only thing is during high fever, do not give califas. During high fevers, do not give califas, even if symptoms tally. And there will be diarrhea, painless diarrhea, watery diarrhea. Stools will be very bad smell, having bad smell. And even the sexual disorders patients' inability to participate, califas will solve that problem because nervous disorders can be set right with this medicine. And califas is also a medicine for asthma. All the Cali medicines, Cali group, even in homeopathy also, respiratory problems and nervous problems both will be there. With this medicine, we can cure even the asthma and other symptoms are present during califas with other symptoms like sleeplessness, memory weak, etc., nervous disorders. You can go for phosphoricum. And the patient says, I have no strength, my nerves are very weak, I am very sensitive to light and noise, and please note down, this is one of the best medicines for paralysis of any kind, any organ, paralysis. If pains are there, give magnesia fast in the morning. We will discuss that. And night califas for all kinds of paralytic patients. This will improve the nervous strength. So that is very important. And another important point in the califas is this is the medicine for epilepsy. Epilepsy also concerned with nervous disorders. So epileptic patients, to make them soothing and sleeping well and other things, epileptic patients also califas is one of the best medicines. And this is called, I told you, the tonic for sleeping. This is a sleeping pill of biochemic system. For any person who is sleepless, califas can be given before going to bed. And also, he has the habit of somnambulism, that is, sleepwalking. He'll get up and walk. He does not know anything, totally not conscious. But morning, if you ask him why you are walking in the room, he said, no, I never woke up. Who did it? Like that, he will ask. So that medicine also is because of the nervous disorder. If you give califas, he will sleep well. At least he will not jump out of the window when the doors are open. That is why whenever a patient is there with somnambulism, sleepwalking, always there must be some attendant with him, and room doors are closed and the key is not available to him. Whereas he'll open the this one and will go out. That is also should not be made possible. Sometimes in these cases, califas patient, there may be skin problem also. That is also is cured with califosforicum. If other symptoms tally, the patient becomes very weak. He has no strength. There will be sometimes even gangrene. And please note down, this is one of the best remedy for all kinds of diabetes. Any diabetes. I have treated many people with califas. Night before going to bed, you just give them 3 or 4 tablets every day for califosforicum. And but always monitor the reading because sometimes even sugar may go up. Those persons who are taking insulin injections also, I gave the califas and stopped the injections also. My own clinical experience I am sharing. Of course, you must be monitoring regularly the sugar levels. There will be some patients where erratic readings are there. The sugar should not go down. In fact, hypo is more dangerous in sugar. When it goes down below 70 or 60, patient may go to coma. So you must be very careful. When you are using other medicines and califas, please observe it closely. And when the patient is feeling better, when the sugar is going down, better you reduce the allopathic units. Insulin, suppose is taking 10 units, make it 8, then 6, like that. Ultimately, I have seen one patient where he was taking 3 times injection, but after califas, totally stopped injections, only on allopathic tablets along with the homeopathy medicine, and this biochemic califas, it will work very well. Remember, this is one of the best medicine with the biochemic system of medicine. This is the Cali phosphoricum. So, Cali sulf is there. Next week we will discuss again. I think I am able to reach you well with very short notes, and you can use them very easily. So, I thank all my masters, Master DK, Chalapati Garu, and my special pronouns to Dr. Satyanarayan Garu, who has provided me this platform. Thank you all. Any comments are there? Any suggestions are there? Please put them in the commentary box. I will definitely try to answer them. Thank you very much. Namaskar. Good night.